Good morning, good afternoon, good evening, and thank you for coming to today's Grand Bargain Cash Workstream subgroup on linking humanitarian cash and social protection webinar. My name is Lois Austin and I work with the subgroup, and I'll be moderating today's webinar, during which we're going to draw on the knowledge of our panel of expert speakers as we look at changing the mindset, turning the theory into practice, incorporating gender sensitivity into linked humanitarian cash and social protection interventions. We'll start the webinar with our usual poll to try and give us an idea of who's participating. So please click the link to let us know if you are a humanitarian actor, social protection actor, both of these or neither of these. And we'll just let the poll run for a few more minutes before we start counting down to closure. So I'll count down from 3, 2, 1. And just see, so the majority of participants today are humanitarians, some 30% of the audience, followed by 27% who are social protection actors. Those that consider themselves to cover both of these are 27%, and then 16% don't consider themselves to be fitting into either of those categories or any of those 3 categories. So just to give a little bit of the background before we get into the substance of today's discussion, this subgroup is co-led by Unicef, the IFRC and FCDO. And part of the work of the subgroup is to reinforce dialogue and knowledge sharing between humanitarian and development stakeholders to support the linking of humanitarian cash and social protection in times of crisis. This area of work, the knowledge management and learning work, is led and funded by Unicef. Today's webinar is structured as a panel discussion and provides the opportunity to hear from a range of humanitarian cash and social protection experts on myths, challenges, gaps and blockages that appear to be standing in the way of moving from theory to the practical implementation of linked or aligned gender-sensitive humanitarian cash and social protection interventions. In spite of a growing number of resources and tools promoting the application of gender-sensitive approaches, both in humanitarian cash and social protection responses, there continues to be a need for an improved understanding of how to put this into practice in linked interventions. Each of our experts is going to provide a solution or a myth buster on the challenge that they've identified. Depending on the time available, following the expert presentations, there should be the opportunity to ask the panel questions. So please do send your questions to the experts. If you could put them in the Q&A box, and we will try to respond to as many as we can before the webinar ends. Please mention if your question is directed towards a specific panelist, your own name and organization, and we'll do our best to provide some written follow-up to the questions that we're not able to respond to during the webinar. And it may be the case that actually, depending on the length of the points put forward by the panelists, we may not actually manage to answer any of the questions, but we will do our best to. So I'm now going to briefly introduce our 7 experts who represent 6 different organizations. They've identified a number of myths and challenges surrounding the integration of gender perspectives in linked humanitarian cash and social protection interventions. In the interest of time, I'm not going to go into the bios of each of the speakers, but you can find these in the chat box here on the Zoom link. So just briefly, we're really lucky to be joined by experts from different humanitarian agencies, the academic sector, the social protection sector, and the World Bank. Firstly, we're going to hear from Opa Maravanyika, who is the Senior Technical Advisor for Gender, Food Security and Resilience for CARE USA. Then we'll hear from Kathleen Beagle, who is the Research Manager and Lead Economist in the Human Development Team at the World Bank's Development Research Group. After that, we will be joined by Juan Gonzalo Jaramillo Mejia, who is a social protection specialist. Then from UNICEF, we will hear from Ruth Graham Goulder, who's UNICEF's Social Protection and Gender Advisor. Then Rachel Slater, who is Professor of International Development at Wolverhampton University. And finally, we'll be joined by 2 experts from the IFRC's Americas team, Lucia Steinberg, who's the IFRC's Regional Cash Delegate, and Evelyn Vallejo Salcedo, who is the Protection, Gender and Inclusion Senior Officer for the IFRC. So I'm going to hand straight over to Opa, who will help to dispel the myth that gender interventions in CVA are synonymous to women. So over to you, Opa, who will draw from CARE's experience in a number of countries, including Zimbabwe, Ethiopia, Malawi, and Sudan. Thank you, Opa.
Thank you so much for the time. I'm really excited to share our experiences as CARE around gender integration in cash and voucher programming. Like Louise has mentioned, I want to go directly to one of the myths that we encounter in our programming, which is gender interventions in cash and voucher assistance are synonymous to women. So what we have come across is generally humanitarian partners, including community groups or participants that we work with. They have perceptions that gender interventions are designed to focus only on women and they are there to benefit women only. So what we have actually realized in terms of the key challenge here is that there is limited knowledge and skills on how to effectively integrate gender responsive approaches in cash and voucher assistance programming that we implement. And we have also noted that humanitarian cash and social protection programming is gender blind with little attention given to specific differential needs, be it of women, girls, men, and boys, and people of all genders across the program cycle. I would also want to share with you some of the information that we gather from the field pertaining to our cash and voucher assistance programming. Where it has been revealed that due to entrenched gender norms and unequal household power dynamics, women have little or no decision-making power with regards to the use of cash at household level, and this can even lead to gender-based violence. We've also noted that men are usually the heads of the households because of the social norm structure and are the main decision makers on use of household resources. One thing that we have also noted is that women are key actors, we know, in the market space, be it as buyers, as sellers, or even suppliers. But due to gender norms, women face gender constraints in accessing markets. For instance, they need approval from a spouse to be able to go to the market, or they can even be at risk to gender-based violence on the way to the market. These are some of the issues that we have gathered from the field in the work that we do. But like I've mentioned before, one myth that we have is really gender interventions are synonymous to women. And for us as CARE, we have been implementing different models to try and dispel this myth. I'll start by sharing with you the CARE Gender Equality Framework, which really speaks to three important components that we focus on in our programming. One, which is building women's agency, confidence skills, their competencies. So basically I'm saying, yes, women and girls are at the heart and center of the work that we do. But we also acknowledge that there's need to address issues to do with relationships. So when we look at our gender equality framework, agency is key, but we're also looking at changing relationships. And what do I mean by that? We work with men and boys to address issues to do with gender-based violence at household level, at community level. We also work with influential people to ensure that we have equitable relationships at household and community level, very important in the work that we do around cash and voucher assistance programming. And the third aspect that we focus on, which is really important for us as CARE, is transforming structures. As you have heard from me before, I've highlighted aspects to do with social norms that really impact on the work that we do in cash and voucher programming. So transforming structures is key and is one aspect that we really look into. So just to emphasize that, yes, women and girls are at the heart and center of the work that we do, but we also look into issues to do with relationships, and we also look at transforming structures, as this is really key in the work that we do. So I'd like to share with you one or two practical processes, mechanisms, and approaches that we use in addressing or integrating gender equity in cash and voucher programming. And for us, we are saying this is Cash Plus, the complementary multimodal interventions that we also integrate in the work that we do with cash programming. One is really conducting a gender analysis. So for us as CARE, conducting a robust gender analysis at the inception of every program or project is of paramount importance, because we feel it's important to establish the gender constraints, gender barriers, gender opportunities that are there within the context that we can work with and leverage on so that we address the issues at hand. So first and foremost, we design as care, and we have got, we lead extensive gender assessments at program inception, so that we determine these gendered vulnerabilities, the capacities, opportunities to inform gender equality and social inclusion interventions. We also look at issues to do with social dynamics. Yes, it's important to focus on sex and age disaggregated data, but we also analyze the gendered household types, be it a female-headed households, and what are the specific constraints that are faced in these households. We look at young people, what are these constraints, opportunities, or gender barriers associated or that young people face, and also adolescent mothers. So we capture women and girls' voices separately and include gender responsive issues. So one thing that is really interesting for us is when we look at our gender analysis framework, we have what we call the 8 areas of inquiry. These really help us to unpack the gender issues at hand. We look at gender-based violence as one area of inquiry, leadership and participation in positions of leadership. We also look at issues to do with access and control over resources. We also look at issues to do with gender roles and responsibilities. So the framework for gender analysis really helps us to dig deep into understanding the gender issues at hand. Once we have conducted the gender analysis, we go on to make sure that we have a budget, gender responsive budgeting in the work that we do. We are intentional to make sure that gender activities are funded and supported. And we also make sure that within our programs, we develop what we call the gender action plans, so that by the end of the day, we really pick on the specific activities, gender activities that are supposed to be supported within the program. And when we do develop the gender action plans, we make sure that in our action plans, we support establishment of a gender expertise to support the program. So in most of our programs, you see, like for instance, in Zimbabwe, cash programs, we do have what we call a gender and accountability officer there to make sure that they support, they ensure that gender is effectively integrated within the program. We also institute safeguarding measures so that by the end of the day, the project participants, they provide feedback and complaints, and these are received and acted upon by the program. So we make sure that we have, for instance, suggestion boxes, the hotlines, and create safe spaces for feedback from our community participants. Trainings are also conducted within our programs. For instance, the prevention of sexual exploitation, harassment, and abuse training is really key as part of the work that we do, and train different community groups so that by the end of the day, we address issues to do with sexual harassment. We conduct cash post distribution monitoring processes to assess cash utilization by the different vulnerable groups, including women. Remember, I've talked about some of the social norms that really surround the aspect of utilization of cash at household level. And I've mentioned that women have limited control or decision-making when it comes to use of cash. So because of the interventions that we are talking about here, we also institute or create an opportunity where we do monitoring to check whether the utilization of cash is beneficial to the household and to the women. And I've also talked about complementary multimodal interventions. In this, we also build in a social norm component, social norm change component. And what we have been doing in our cash programming is really bringing in some of the models and tools like social analysis and action and gender dialoguing at community level to try and address some of these gender barriers that I've mentioned before. So SAA has been built in our program so that we address the cultural norms associated with increased workload for women, the social norms associated with limited decision-making or mobility challenges for women. So bringing in a social norm change component has been really useful and bringing in some change in the work that we do. Integrating GBV prevention and risk mitigation has been very instrumental in the work that we do. And we have tried to even share information around GBV referral pathways with the program participants, so that by the end of the day, they know where to get a service in the event of a gender-based violence case. And we've also been sharing GBV messaging to ensure that we talk about GBV prevention. And I've mentioned the aspect around engaging men and boys to dispel this myth that we don't only focus on women. Yes, we might identify women's constraints and vulnerabilities through a gender assessment, but in terms of strategies and approaches, there is need to appreciate the influential people and the role that they play for gender responsive interventions. So engaging men and boys, working with men to have male champions, to address these different household gender dynamics has been really important and instrumental in the work that we do. And I also want to share with you.
I'm sorry, I might just have to cut in a bit because in the interest of time, and hopefully we can come back to you, but just to make sure that all the experts get their points across. But thank you very much for highlighting some of the approaches adopted by CARE in different countries. I'll now turn to Kathleen from the World Bank, who will address the myth that giving transfers to women results in higher spending on family-friendly goods and better outcomes for children. So over to you, Kathleen. Thank you.
Thank you. Can you hear me okay?
Absolutely. Go ahead.
Great. Well, it's a pleasure to be here today. Good morning, good afternoon, good evening, everyone. I wanted to speak to myth number 2, which, to repeat Lois, is the myth that giving women transfers results in higher spending on family-friendly goods, and particularly on better outcomes and spending for children. So here I want to make 5 points to you today. The first point about this myth is there is no evidence to support it. I frequently read studies or program design documents that attest to that there is evidence that giving the cash to the woman instead of the man in a household will tilt spending in ways that benefit children, particularly education and health spending. And this supposed evidence is used to justify or rationalize a decision to give such transfers or social protection programs to the woman in the household. Now, a side note, I do not want to confuse this with a discussion around selecting male or female headed households into programs. So here I'm looking at the within household beneficiary targeting of cash receipt. So where is the evidence? In fact, from looking at the literature, I find that this is a very flawed assumption about how an SP program will impact outcomes for children differentially if the mother, a woman, receives the assistance rather than the father, a man. Arguably, the most frequently cited study about this evidence is from a 1990 Economist paper on Brazil, looking at unearned income, but there are a number of caveats to how one can interpret those findings. Since that 1990 report, a number of well-designed studies have shown mixed and inconclusive findings from cash transfers where the recipient was randomized to the husband or the wife, the man or the woman. And a 2016 review of 165 studies conclude that there was not strong support for differences arising from specifically targeting men or women in terms of children. And a review from 2019 from IFPRI also confirmed and had similar conclusions. This draws on studies that have been done in places like Morocco, Kenya, and Burkina Faso. So certainly more evidence is needed on study designs since context matters. Morocco, Kenya and Burkina Faso can't speak to many other settings, and there is evidence from other countries, but not every country. Still, the evidence indicates that positive outcomes for families and children are possible even when dads get the cash, and may be equal to giving the cash to women. So there are careful trade-offs that need to be considered when establishing a rationale for choice of the target recipient within a household. And I'll come back to that in a moment. But first, I wanted to come to my second point to mention today, and that's a bit of a side note on the topic of myths and social protection. Certainly, other myths have managed to be busted with solid evidence, and here I'm making a case for more evidence on this particular myth. And I'll point to one example. There were long held and well-established views that have been proven wrong by evidence, particularly that poor and vulnerable households would spend unearned cash on temptation goods like cigarettes and alcohol. And we now have a wealth of evidence, well-established evidence, that recipient households do not spend on temptation goods by and large. And furthermore, the evidence shows that cash, whether conditional or unconditional, whether paired with other services, can have big impacts on improving welfare for households, both children, husbands and wives, men and women. So let me come back to this myth today and talk about a third point I wanted to make to you. Of course, the perception of outsized benefits to children is not the only reason to give the cash to a woman instead of a man in a beneficiary household. And we've just heard from Opera from CARE that there are many other reasons one would want to target a female in a household related to women's economic empowerment or empowerment in general, and vulnerability to violence against women and other reasons. But specifically justifying on the basis of outcomes for children is not proven out, at least by the evidence we have to date. This brings me to my fourth point today, which is just to raise the caveat. So there are challenges that we should consider when programs use women instrumentally as mothers or caregivers rather than for intrinsic reasons such as contributing to gender equality or empowerment of the woman. Programs which target women for instrumental reasons are more likely, potentially more likely, to inadvertently increase time costs for women through, for example, required trainings that they may need to partake in as a beneficiary, or potentially the burdens, the feeling responsible for program conditions or eligibility. As well, targeting them instrumentally may reinforce traditional notions of gender roles, that women are the caregivers always and the mothers. Studies of conditional cash transfers in Latin America show that these factors can have adverse effects on women. But this brings me to my fifth and final thought on this myth. In any case, it turns out that the vast majority of programs in the social protection space, whether or not in humanitarian settings, at least where we have survey evidence on these programs, are already targeting female beneficiaries. And I will put in the chat a link to the State of Economic Inclusion report that colleagues at the World Bank released in 2021 that has a spotlight section that surveyed programs on their targeting approach within the household and found that the vast majority are already targeting women. So it's not so much a matter of necessarily changing that approach, but rethinking what is the rationale and the reasoning behind that, and having a clarity of vision behind that choice. Thank you very much.
Many thanks, Kathleen, for that. In the interest of time, I'll just move quite swiftly on to Juan Gonzalo, who's going to draw on the experiences coming from Latin America, as we've heard a bit from Kathleen, so Colombia, Mexico, and Brazil, in relation to the myth that children's well-being is dependent on mothers' well-being. Juan Gonzalo, I'll hand over to you.
Thank you, and a pleasure to be here with you all. So yes, I'm going to talk today about this myth on child's well-being is dependent on mother's well-being, and I definitely agree that this is the case, but we need to have a nuanced vision of, or an understanding of this statement, particularly for social protection, where we see that mothers are seen as the most effective development conduits to ensure the rapid impact of targeted social protection investments in nutritional health and educational outcomes for children. Men, on the other hand, are often excluded on the premise they are part of the problem and rarely part of the solutions. So therefore, key problems that I see here from our research is first that programs often overemphasize motherhood, creating expectations and increasing the responsibilities of women, which are often unrealistic and disproportionate. We see this from the research of Maxine Molyneux and Tara Cookson, particularly from Mexico and several Andean countries. Then we also see that there's a second problem, which is that programs tend to see women instrumentally, often failing to meet their practical needs and respond to the particular risks and vulnerabilities they face. And Naila Kabir, as well as our colleagues from ODI, Nicola Jones and Rebecca Holmes, have often made this point. But Sylvia Chen and Matthew Goodman, since the early 2000s, have seen this so often happening that have asked, the point on what women can do for social protection, what can social protection do for women, which is kind of a paradox in this sector. The third point is that we see how programs exempt in a way men from taking their fair and due share of domestic work and their caregiving responsibilities, emotionally depriving them from their personal realization as fathers, and perpetuate, unfortunately, the gender status quo with huge costs for women in terms particularly of time poverty. And fourth, I would say that here we see how by not addressing men's caregiving responsibilities, gender inequalities are transferred along socially underprivileged lines, deepening other inequalities based on ethnicity, age, and class, for example. So we see, for example, in Colombia, my own country, the flagship conditional cash transfer, Familias en Acción, provides a really good example here. For more than 2 decades, the program has heavily relied on local elected mother leaders to support the implementation, as well as to enforce and motivate through leading by example narratives in which women can fulfill conditionalities with the example of others. They're gender specific in that they only target women who are expected to shoulder a multitude of responsibilities on their own, from ensuring children's attendance to school and medical checkups, and hence entrepreneurship, savings, and investments. But this myth that permeates very much the narrative around the program works, and it manifests in standard data sets on child nutrition, for example, where mother education is used as an indicator to establish casualty without any consideration of the father's role and relation to such outcomes. Such narratives that miss men out of this equation reinforce the gender division of labor rather than challenge and change it. So the question I have for a discussion is, why are we emphasizing fatherhood as much as we are emphasizing motherhood? Why are we factoring in men's role and education level, for example, in children's well-being? Why are we creating program provisions to alter men's attitudes and behavior with such an emphasis that make the achievement of gender equality a venture that is not only shouldered by women? Change can happen when gender is understood in a relational experience rather than it's specific to an individual. And this is kind of like the key message I want to bring today. My research from Mexico and Brazil indicates that safe spaces for introspection and dialogue can lead to questioning of prevailing and pervasive social norms that often privilege men, but doesn't empower their family members. This we know it as the patriarchal dividend. But men's recognition of their own disadvantage or of a loved one rooted in those largely unexamined and social norms that engender them as well is the first step to incentivizing many men to engage in responsible fatherhood and to be in favor of gender equality. But to finalize here and give the floor to my colleagues, the most important element we need to be able to do here is to have a good poverty and vulnerability analysis that is gendered, but one that applies an intersectional lens where we understand how different social norms interact and compound. In this way, we can prioritize groups that, due to economic, geographical, social, and often intersecting inequalities, will require more urgent, robust, and a diverse set of support. Quite importantly, by doing this gender poverty and vulnerability analysis, we will be, that is intersectional in nature, just to be clear there, we will be able to ensure to abide to a no harm principle, where we can create safeguards and at the same time be able to meet not just the practical needs of women, but their strategic ones. With this as a basis, we will be able to have these personalized communication channels, consultations, disaggregated data for monitoring and evaluation, but we will be doing it based on concrete and contextual evidence. So that is from my side. Thank you.
Many thanks, Juan Gonzalo, for those important points. We'll now hear from Ruth, who will talk to us about the tick box approach that's sometimes adopted in terms of targeting women with cash transfers and considering this to be gender sensitive or gender responsive. Over to you, Ruth.
Thanks so much. I'm really happy to be here. My name's Ruth. I lead on gender and social protection at Unicef. And as Lewis said, the myth that I'm going to be unpacking is that if you give cash to women, the job is done and you can tick off gender sensitive, we're sorted, we can go on our merry way. I think this very much builds on what my colleagues have said about the other myths. And the first thing that I would really like to do is just take a moment to highlight that I think these myths are very much interlinked. Because there's a reality that they're grappling with. There are beliefs, norms, and assumptions that are fundamentally patriarchal. They're part of our lives, what we live with, what we work with, the institutions and context where we're working. And I think underpinning this, there are a number of different specific beliefs, one of which is that gender inequality is not important or life-threatening, and it's therefore not worth prioritizing for humanitarian or social protection work. And I think that can manifest as women spend on children more than men as a given, or in this case, if we give cash to women, then that's gender sensitivity done. But I think we need to have that framing and understanding as we break down what we do into really concrete and practical actions, and in terms of our programming work, have that framing in mind. The other reason I think for this specific myth around targeting is that it's basically inclusion in its most basic form. It's sort of like starting a hurdle race and getting to the first hurdle and then saying, okay, right, I'm done now, I don't need to carry it on. As others have highlighted, it's not intrinsically gender sensitive to only target women. There may be good reasons for doing that, but we need to be really clear about what the rationale for that is. And we need to look at it systematically across the program cycle. So with my brief sort of 5 minutes left, I thought it might be useful to really unpack practically the kind of things that we can be doing beyond targeting. And I thought particularly I would hone in on aspects of UNICEF's work for the Yemen Emergency Cash Transfer Programme. This is a programme which is essentially safeguarding the social protection system. The targeting has already been decided based on sort of pre-conflict list. That's sort of not even a question. It's obviously a very challenging operating environment, and the team has done some really dedicated work on gender mainstreaming. So I thought that might be useful to sort of showcase very specific things that have been done. So I've decided to highlight 6 key areas. Very happy to talk more about them in detail, or some of the other areas that we've been working on. But the first is gender analysis. So as others have mentioned, this is a critical part of understanding the impacts and needs arising from an emergency. It's also not a nice to have, and I think this is part of this sort of underlying problem from which many of these myths come. The idea that, if we've done vulnerability analysis and it looks at food insecurity and in a number of, I guess, sectoral areas, then the job is done. And if there isn't sort of gender expertise or specific gender analysis through that, well, it's not so important in comparison with these other kinds of needs and inequities. And obviously that's not the case. It's critical for understanding how to respond to girls and women's needs in that particular context. What are the most pressing needs? Questions around indeed targeting and delivery, the potential for backlash as a result of gender norms, and the kind of risk mitigating actions that we should consider. So for example, in UNICEF's work in Yemen on this emergency cash transfer program, we undertook comprehensive gender analysis and GBV analysis, which then informed a comprehensive gender action plan for the program, and that's recently been refreshed. Number 2, addressing gender barriers and needs in the delivery of the cash transfer program and adapting as we go. So I thought, given time, I would just highlight a few, but some very practical things that we've done. First of all, we have contractual provisions that require the presence of at least one woman staff member at each payment site, which can be quite challenging in the context in question. Women-only payment sites in some areas, payment sites chosen and reviewed with consideration of the accessibility and suitability for women, including with reference to their safety and dignity. So, for example, main district markets might not be seen as appropriate because of norms and safety concerns and so on. Another feature which I think is really interesting, and I can imagine in many other less challenging contexts might be said to be too expensive or too challenging, but in fact is being done, and that's priority services and home-based delivery of cash for a number of different groups, using a sort of intersectional analysis of challenges that people face. So that includes pregnant and lactating women, persons with disabilities, and older persons who are entitled to home-based delivery and sort of priority services at the payment sites. One thing to flag in terms of adaptation, we realized that people weren't always taking up the offer of home-based delivery because that was happening later on in the payment cycle, which runs over a few weeks. And so we shifted to doing that at the beginning of the payment cycle because people were worried that they weren't going to receive the cash. So they went in person, even if it was a sort of personal cost. Number 3, looking at the opportunities for messaging and information with a program that is tailored to girls and women's needs, and checking and ensuring that the communication channels that we're using are accessible to women and to other groups. So for example, in this Yemen program, one of our communication channels is facilitation briefing meetings, but from our monitoring and evaluation, we can see that many more men were attending these, and so we took a number of different practical actions to address this. We scaled up communication through a number of different avenues in posters and WhatsApp messages and so on. We increased women's only meetings, and we also developed a specific women's only communication network. Number 4, conscious of time, so racing through, providing complementary programs and services that respond to gender-specific risks, needs, and opportunities where we can. So, for example, pairing cash with other asset transfers that might be needed. For example, in emergency contexts, menstrual hygiene kits, something that's often forgotten, but is critical. Linking to GBV response services and so on. Number 5, training staff and ensuring focus and capacity on gender. I think this is something, again, that links back to this fundamental idea that it's not very important. We need to ensure that we have that capacity and expertise to address the challenges, not just right at the beginning of the cycle or right at the end when we're writing a report about what we've done, but throughout. And that means having staff on the ground as part of the team, whether that's as part of a national government programme or a parallel system, who understand this and who have a responsibility for it. So in the Yemen emergency cash transfer program, we have a dedicated gender task force, and that draws on team members that have responsibility for different operational areas already, and they sit on the task force and they lead on different aspects of the gender action plan. And then 6th, last but not least, improving M&E to understand the gender risks and experiences and act on them. So yes, of course, sex disaggregated data, look to address the gaps, ensure that you have avenues for understanding how the program might be having a negative effect. So for example, is the timing or the location of the cash delivery unsuitable for women due to social norms, roles and responsibilities that they take on, and so on. As an example from Yemen, we are, as alongside our sort of quantitative methods for monitoring, we also have dedicated women's only focus group discussions to try and better understand women's experiences of the program and adapt our program accordingly. So in summary, racing through this very rapidly, these are just examples. I wanted to give, given the sort of focus on translating theory into action, just some very concrete things that we're doing in a challenging operating environment. Gender mainstreaming is possible and necessary in emergency contexts. Many of the choices that we talk about may not be directly in the control of the implementer or the designer or the organization that's funding the program, but we have to do what we can with the context that we're working with, and we need to translate that that theory of gender sensitivity into that really practical nuts and bolts action. And my final point I just want to emphasize is I think that has to be situated within an acknowledgement and understanding of gender inequality and the drivers of gender inequality, because without that, I think it's very easy, the resistance and the myths around this, to win out. So I think that analysis is critical. Thanks very much.
Great, thank you very much, Ruth, for speeding through that. We'll go on to Rachel now, who I think is going to dispel myths from 2 different ends of the gender transformative spectrum, possibly using the example of the current devastating humanitarian crisis that we're seeing unfold in Afghanistan today. Over to you, Rachel.
Thanks so much, Lois. Can you hear me okay?
Yes, go ahead.
All right, lovely. So I'm building here on what we've just heard about whether targeting women is enough, and trying to think about myths about whether we can make long-term changes to gender inequality through humanitarian and social assistance. And as Lois has just said, I don't think there's one myth happening here. I think there's 2 that are opposing, that sit at opposite ends of the spectrum. One, that it's not possible, and one, that it is possible to do things that are truly transformative for women and girls within the nexus of humanitarian and social protection. And I think both those perspectives are found simultaneously within the same agencies, within the same context, and even sometimes within the same projects and the same programs. And so it's worth unpacking all of this a bit to find some of that nuance that Juan Gonzalo just argued for, and thinking about how we stop these myths driving the approach that we take, but at the same time are realistic about what's achievable. So my starting point for this goes back to gender and development theories from the 1990s, especially the ideas of Maxine Molyneux and Caroline Moser, that differentiate between things that we do to meet women's strategic gender interests or needs, and the things that we do to meet their practical gender interests or needs. It's a very old theory, but I think it's still enormously valuable here. My favorite example, if you're not aware of this distinction of practical and strategic gender needs, is about collecting water. We know that in lots of parts of the world, collecting water is a job for women and girls. And it's a job that takes hours of time and has women traveling long distances, sometimes in dangerous situations. So if we were to try and do something about that, we might address a practical gender interest by moving the water source closer to where women and girls live. But we'd only address the strategic gender interest if we changed the fact that it's only women and girls fetching water and men and boys started to fetch water too. So that should be a good example of the difference that we're talking about. And for me, we might restate my myth as it's not possible, or it is possible, to address strategic gender needs or interests within the nexus of humanitarian social protection activities. So what do we actually know about this? What does the evidence say? Well, not much, right? So as Kathleen's already said, there are lots of assumptions out there. There are lots of individual anecdotes, but not much solid empirical data. But we do think and perhaps assume that there are lots of reasons why addressing strategic gender needs is so difficult. And that might be why we often resort to practical needs instead. So strategic gender needs are difficult for humanitarian agencies, we assume, or we state, for a number of reasons. Humanitarian agencies focus on short-term, on meeting basic needs, rather than long-term, more transformative goals. Even when they operate in places for a really long time, shorter funding cycles mean it's very difficult to take that long-term perspective. Humanitarian agencies might find themselves with limited space to try something different, with the urgency of trying to save lives. And there's an assumption that humanitarians need to operate in ways in which they do no harm. And that might include not stirring up intra-household or community tensions. That might mean not challenging existing power relations too much, especially in volatile situations, not being the trigger for gender-based violence. And for social protection, where on paper there's more scope for strategic gender needs, programs often have such low coverage and payment level, or people don't benefit for a long time. And programs that target women often reduce them to their roles as carers, mothers, wives, daughters. And Kathleen's already flagged that essentializing of women's roles. Or even when they don't do that and they think about women and livelihoods, they follow models of transformation that I would argue assume that every woman wants to be a petty entrepreneur who sells street food, trades vegetables, or sews school uniform. Still a pretty restrictive model. Our vision and our ambitions for women in social protection are not really that transformative. So how might we move forward? What prospects are there for more of a focus on strategic gender needs? My suggestion is that we focus not on singular monolithic approaches or on these assumptions and pieces of anecdotal evidence. And instead we try and capture more what's feasible in different contexts, what pathways we might follow to get there, and what different configurations of stakeholders we might be able to draw on. So we go about it in a different way. We look for multiple pathways rather than blueprint solutions. We identify which of those pathways involve what configurations of actors to get us there. And crucially, we remember, we're not dogmatic about this, and we remember that we aren't looking for the best or the perfect pathway or approach, but good pathways and approaches. And that means that different agencies will have different opportunities and entry points, and we've got to leverage from those differences rather than try and all do the same thing. So what do I mean by different opportunities and entry points? Well, for example, we can recognize that humanitarian agencies may be able to stress their neutrality principle to ensure that women and girls aren't excluded. And that might help them find better entry points for supporting women. Humanitarian agencies can say it's our mandate to help everyone, and that means women too, in ways that are appropriate to them. And that can be useful, particularly in situations where working with and through government social protection systems affords us very few opportunities to really push a perspective that focuses on women and specific gender needs. A second example might be working through existing government social protection in ways that in the immediate term might reinforce rather than challenge gender stereotypes, that might feel like we're going backwards. But we might be able to do this by keeping our eye on making steady, cumulative, incremental gains in terms of women's empowerment through the more practical things that we do. So we use the practical approach to get to more strategic outcomes. In terms of, I've just mentioned outcomes, I think we also need to focus on outcomes and impacts for marginalized women and girls, and for marginalized men and boys. At the moment, we tend to, in both sectors, focus on inputs and outputs of our programming in really quite a narrow way. They're sort of self-serving or sector-serving approaches to gender inclusion. So, for example, in the humanitarian sector, Veronique Barbalet and Caitlin Wake have noted that the justification for a focus on inclusion there is internal to the sector and instrumental. It's talking about how women can be participants in design and delivery. So it feels like it's including women for the sake of the sector rather than for the sake of women themselves. And social protection can be quite culpable of this too. So in our indicators, we focus on the proportion of women who are recipients compared to men, rather than the actual outcomes of being included for those women. I want to finish by flagging that when I was trying to decide what to say today, Afghanistan has been right at the forefront of my thoughts. It provides a really good example of just how challenging it will be to get transformative change across the humanitarian and social protection nexus. Do we give up on doing transformative things for women and girls in the nexus right now and just focus on meeting women's practical gender needs wherever we can? Or even if we have to revert back to those traditional orthodox views of a woman's place and role as held by the Taliban, even if we have to operate in ways that reinforce rather than challenge traditional gender divisions of labor, in order for us to simply be able to operate, can we at least make some modest incremental gains beyond women's practical gender needs? You know, can we and should we justify getting women involved in decisions about social systems on an instrumental basis that this helps increase the efficiency and effectiveness of the programme, but make sure that we get them involved in ways that increase women's voices? Can we target social protection linked to health and education support using humanitarian principles of neutrality and non-discrimination in order to make sure that women and girls aren't invisibilized in health and education programming in Afghanistan? Can we pick up on some of Ruth's examples just now from Yemen about how we operate in ways that have good outcomes for women and girls and apply them, change the timing and location of transfers in Afghanistan? But I just want to end by saying watching events unfold in Afghanistan has been sobering and for many of us utterly heartbreaking. But I think there are ways in which we can leverage our humanitarian and social protection work to continue taking those small incremental steps to transformation. So let's just keep going with it, even in these most difficult of times. Thank you.
Many thanks, Rachel, for shedding light on the potential for using multiple pathways to implementing transformative humanitarian and social protection interventions, even in some of the worst crises that we see today. And so finally, we will just head over to the IFRC Americas team, to Lucia and Evelyn. Just looking at the clock, I'm not sure we'll be able to answer live any of the questions that have been put forward. I know a couple have already been answered, but we will try and do that in writing afterwards. But I'll hand over now to Lucia and Evelyn. Thank you.
Thank you very much, Lois. Good morning, good afternoon, and good evening for everyone. So our myth is referred to if a gender and diversity approach to emergency programming, including, for example, cash and voucher assistance and livelihoods, considers only women and girls. You will see this myth in your chat. As Lois stated, so we are going to share this myth together with my colleague Lucia. And just a gentle disclosure, some of the recommendations will come from our context based of Americas. So definitely some adaptations to other contexts you may hear need to be taken into account. I'm going to start with the challenges we have seen and of course the hindrance in relation to the myths. And we are parting, as I foresee, from two key concepts you already heard, for example, from Juan Gonzalo and Rachel, specifically from the base of intersectionality and also in the gender equity continuum of gender transformative actions. So as you know, when we talk about intersectionality perspective, we emphasize the importance of considering the several layers persons have in terms of gender. So we're talking about gender identity, gender expression as well. And with this being said, of course, by our recommendations, we want to make sure we address the causes of gender-based inequalities and how to transform harmful gender roles, norms, and power relations. So these two concepts are basing the information we are going to provide, because the understanding of gender for IFRC is beyond the binary spectrum of sex and gender system. So some of the challenges we have seen in relation to have this binary perspective of gender is definitely the tools do not gather information on the perspective of the gender umbrella concept. So by using, for example, only sex and age disaggregated data, these will left behind and left out specifically non-binary options for a specific population who do not identify with these characteristics. Generally speaking, the tools are missing guidance for those collecting the information as well on how to reflect, for example, gender identity data, or to help people feel at ease so they can self-identify as diverse gender categories when responding to surveys. And as you know, to collect data and to have a gender analysis is our point of entrance to have an effective implementation in our programs. Beyond that, there are gaps in the disaggregation of data collection, including specific variables such as disability and ethnicity. As you may know, in some of our countries, we do have gender identities refer to ethnicity. In Canada, for example, we have two-spirit persons, of the Muches in Mexico, or the M community in Haiti. This requires to us going beyond the binary perspective and having as a gap that the ethnicity and gender are not intersecting. Other challenges we have seen is, for example, there isn't a targeted analysis of gender diverse populations. So if the analyses are done linear and not multifunctional and with other sectors such as protection and gender, this could lead as consequence, as I already said, that we left out of the interventions specific communities who are often marginalized. However, that's other challenge, and thank you to Rachel for putting it out. By revealing and giving visibility to certain gender diversity aspects of the persons, we can also put these populations into harm or security matters. So collecting this type of data with these populations might not be prioritized by actors because of these security measures, but also because of the absence of capacity building referred to gender ethnicity based in the context we are implementing. In addition, also as Ruth says, we completely agree that unfortunately having gender and diversity perspective and gender transformative actions might not be mainstreaming to the other sectors, which can affect the programming itself, only having targeted actions in terms of GVV in focalized projects, but not necessarily a mainstream approach. What we have seen is the binary conception of gender often affects implementation and could perpetuate gender stereotypes in the programming of specific projects of livelihoods. And definitely, we are seeing more like a necessity than a challenge, that the aid sector, the humanitarian sector, we're speaking from I4C, and also with other organizations, we need to catch up on the conversations around gender and intersectionality. We need to be at the speed and at the same level of the reality of our communities, recognizing that gender goes beyond a very strict and heteronormative perspective of the communities. But what to do? So what can you do, and what are the main solutions we have seen in the field? So I will leave the floor to my colleague Lucia to the solutions to dispel the myth. Thank you.
Thank you very much, Evelyn. In the interest of time, I'm not going to go into detail or into all the list of the things that we had. Some of the things had already been mentioned by some of our colleague speakers. So starting with teams, there needs to be a comprehensive training for everybody on intersectionality of gender and diversity. So go beyond the training on gender and let's start talking about intersectionality. What does that mean? And what does diversity represent? Then more from an operational point of view, in terms of data collection, it would be necessary to create or to adapt tools to the intervention context and to the diverse characteristics of the population that you're working with. It doesn't help, as Evelyn was saying, there are different examples of non-binary population who are also crossing the ethnic, let's say, category. And so this might not be something useful in some contexts, but it might be very, very important in others. In terms of data entry fields, we have seen that many organizations are using only the field for sex. Maybe expand that to gender, which is something that we're already seeing, but let's try and add additional fields, and also let's try and keep them open text so that we don't have like pre-filled options that are basically putting people into boxes, because the idea of intersectionality is understanding how the different characteristics are crossing. Something very important that is has happened to all of us probably is don't make assumptions on names. Don't think that this person self-identifies as a woman because their name is X, or because their gender expression might lead you to think that ask. I know that this might sound very basic, but it's a little first step to get going. We also understand that in emergencies, it's already super difficult to gather that data. You're already struggling because you need to get to the affected area where the population is, and there are all these assessments that are ongoing. So there is a need to find a balance between what information are you gathering to design your program and the time that you need and the swiftness of your response. That's fine. Why not include some specific like intersectionality questions into your assessments that are already existing? So you don't need to do an additional assessment at that very first emergency moment. And then what you can do is, as the emergency moves along time, you can start adding additional assessments. For example, a good practice that we have is that after ETA and IOTA hit, I4C deployed a protection gender and inclusion person 1 month after the hurricanes hit Honduras, so that they could do an in-depth intersectional analysis. So it's fine, get your people to the ground in the first emergency, do what you can, and then as the emergency evolves, seek how you can start integrating the more sort of in diversity and gender elements to your assessment into your program. Then entering into program design, use that information that you have gathered. Use that information to inform your design, to do adjustments of the program. This is best done if you have a multidisciplinary team. Don't put this on the shoulders of your protection or gender people, because often they are not the ones who have the power to actually do the design changes. So make it a responsibility for everybody. And also thinking about the resources that you might have. It's okay if you don't have a specific gender or protection person in your team. why not use the protection cash working group, for example? In our experience with the cash working group, we have seen that we can go beyond the coordination of the 4 Ws and actually push for some technical support. Just 1 minute, Lois, apologies. We also have another example from the Bahamas, Hurricane Dorian. We used the Washington group questions to identify people with functional limitations, and then the shelter response prioritized these people and also included some accessibility considerations into the rebuilding. And last but not least, moving forward and learning, it would be important to transfer this knowledge to the social community and grassroots organizations, or maybe just learn from them, because probably they're already doing things that we have not considered. And it will be really important to start gathering evidence into case studies on initiatives that look at intersectionality, gender, and diversity from a broader perspective, because we have worked on vulnerability categories for many years: women, children, elderly, disabled. How about we start looking at how this cross-sect and we stop leaving people out just because they don't fit in one of these categories? Thank you very much.
Thank you, Lucia and Evelyn. Actually, I'm going to ask all the experts to just put their panel to put their cameras on, even though I'm afraid we won't have time to do live questions, but I think the panelists have actually been responding to the questions in the chat box as we've been going along, and any others we will try and follow up and put on the socialprotection.org website. So just to sort of sum up from today's discussion, as Ruth mentioned, the myths and the challenges that we've heard about are all linked. And there are many beliefs and assumptions that seem to be held, including that gender and equality isn't important, isn't worth prioritizing, or simply that it's an additional aspect that needs to be considered. And from a practical perspective, the experts have shared with us some of the approaches that they've already adopted, their agencies have adopted, or the research that they've done has shown to be adopted to overcome some of the hurdles, and including the critical importance of conducting robust gender analysis to inform the design of gender sensitive and gender responsive linked humanitarian cash and social protection interventions, and the essential need to ensure trained and skilled staff who have the requisite capacity and expertise to ensure gender mainstreaming. We've heard that in spite of all these assumptions and myths, ensuring gender sensitive and gender responsive linked humanitarian cash and social protection interventions is possible across a range of contexts, including the Bahamas, Colombia, Zimbabwe, Yemen, Brazil, Mexico, Malawi, and Sudan, and including from Rachel some thinking on how this might be relevant in really fragile and fluctuating contexts such as Afghanistan. So I'd just like to take the final opportunity to thank our really wonderful panel, actually. Thank you, because you all did a lot of preparatory work for this webinar. So, you know, we really appreciate that. And a recording will be available afterwards on sp.org. Please do complete the feedback survey that's going to pop up on the browser at the end of the webinar. And I just take this opportunity to thank you all and wish you a good day or evening or afternoon ahead. Thank you.
Thank you.
Thanks so much.
Thanks. Take care.
Thank you.